believe it is our fate to be here. It is our destiny. I believe this night holds for each and every one of us the very meaning of our lives. This is a war, and we are soldiers. What if tomorrow the war could be over? Isn't that worth fighting for? Isn't that worth dying for?
What I love about Brody is the small class size and individual attention to self. You're not just a number, but an actual student. And for somebody like me who might need to hear things in different ways to be able to grasp a concept, I think the professors really care about the student and actually want them to learn and do better and take an active interest in helping them to learn and be a better position in the future.
Hey, I'm Kenya Caldwell. I guess I am considered a non-traditional student. I am a wife and a mom, and my previous career I was a CPA, worked in business, did accounting, tax accounting specifically, and a good probably 10 years ago decided needed a change. There was something else that I was supposed to do, and so been on a long path trying to get here to Brody, and very glad that I did it. I feel that this is what I was put on this earth to do, so trying to make it through. Love Brody. I'm so glad that I ended up here. It's kind of difficult. My family, my husband and daughter live in Durham, and I'm here during the week in class, and then I travel home on the weekend, so it makes it a little more difficult, this path right now, but Brody has been very embracing of my situation. The professors really want you to succeed here. I truly believe that. Gotten plenty of help, always offering help, and so that's been really great. I definitely feel that it's more of a family atmosphere, less competitive than maybe some other schools. Everyone's here has been very helpful. Other classmates try to help you out. People put stuff out for everybody else to use, so that's been really good. I don't think anyone's trying to climb over other people to get to the top, so everyone's trying to help each other out.
We have really small class sizes and a lot of personal attention, especially third year, when you can be just one or two students per team and get a lot from having one-on-one time with your residents and attendings.
I love Brody because of the people in the class. I think they did a great job at choosing everyone here. I learned something new from everyone every day. Everyone's always willing to share. So if you've been chosen to come to Brody, then you should consider yourself really lucky to be joining a family.
So my name is Ashley Hink. I'm a third-year medical student at the Brody School of Medicine. I'm from Raleigh, North Carolina, went to NC State and Emory for grad school, and I came to Brody for a lot of different reasons. And one of the things that's really special about our school and where we're located is the tremendous amount of need in this area and the amount of service that students do. I was really interested in continuing some of my interests and work in the field of domestic violence. So I got plugged in with a local agency, and I wanted to be a health advocate for the women living in one of the safe houses here that were trying to leave abusive relationships. So I would interact with them and their children, who often live there for months at a time, trying to find jobs, trying to support themselves, and a lot of them didn't have health insurance, or they lost it when they left their partner, or they had a lot of disabilities and a lot of issues going on. So I would help them access health resources and would act as a health educator for them. I would take them to their doctor's appointments. I would help them qualify for resources. I just did whatever I could to help them. So whatever you're interested in, whether it's childhood obesity or violence-related morbidity like me, you can find a need, because there's so many needs in Eastern North Carolina, and it's so great to be at a school like Brody that really supports our interests and our desire to help the community and try to find projects like the Schweitzer Fellowship that'll actually provide us funding and support to actually be able to perform these things.
What I like about Brody is that the first day of orientation, one of the deans knew my name before I knew anybody's name and said hello. It was awesome.
Probably
probably for me one of the best things about being a soon-to-be Brody graduate is that everywhere I went for residency interviews, they all talk about how they know that I got a solid education here and that I'll be a good resident. They don't have to worry about anything.
And the emphasis here is really on student education. I know students from a lot of other places who didn't get the same exposure that we did, or the same people to teach us day in, day out. Every day in the MICU we get a lecture by one of the fellows, which is very rare. Even at a place where we see such a great pathology, we're exposed to great learning and great clinical experiences.
I think even kind of tacking onto that, I've heard from a lot of residency interviews people that our clinical skills are actually just a little more advanced than a lot of the other people kind of coming out, and that's what they really do like about Brody students is we can do the academic stuff, but when it comes to being an intern, you have the clinical skills to kind of get the work done, but also learn at the same time. I came to Brody because I was interested in primary care at the time, but I really didn't know what I wanted to do. But I think Brody was really good. That there is a mission for primary care, but also they support you in whatever you want to do when you come here.
Yeah, we have people going into dermatology, radiology, ENT. So everything is open. As long as you're self-motivated, you can find a field. And I would also like to point out, there's a great gym nearby. I was recently in the intramural racquetball tournament, and I'm the mixed doubles champion with another fourth year. I have the t-shirt to prove it. So the opportunity is for fun, and it's really a family here. So me and the other fourth year, we had a great time, and we won. So
Come
it's
to
a great
Brody,
place.
be a winner.
No complaints about Brody School of Medicine. We'd love to see you here next year.
I think one of the great things about the Brody School of Medicine is the fact that students are an integral part of every piece of the school. I'm one of the class presidents, the M2 class president, and we have been very integral in changing the curriculum here. So year after year there are tiny things, big things that we want changed, and the students can go to the administration and the dean and sit down and talk about what we'd like to see changed, things that could be tweaked or improved, and they listen to us. And the MSC, or the Medical Student Council, is very integrated with the faculty, and we know that we're being heard and good things have changed, and we continue to improve this school based on student feedback. And I think that's very special for Brody.
The food is excellent, very cheap.
I think for me, the most important thing was just knowing that I would have a class size that where I felt like I could get help if I needed to, where my professors were really cared about my learning, and where I guess we could be more collaborative as a group. So I think that's the reason why I picked it, although I didn't realize beforehand that the small class size would be so important. Right now I feel so close to every single classmate, and I just feel like we all get along and we all are very supportive of each other, so it's something I didn't really think about, but it's definitely made a huge impact, because no matter where you go, medicine is going to be hard, so having a good group of people is going to make it so much of a better experience, and for me that's made the difference, totally.
I think the opportunities are endless, whether it's shadowing a physician or getting extra help from a professor. You can really tell that the faculty and staff are there to help you succeed.
My name is Sonny, this is Stephanie. We're both Brody Scholars, and really the Brody Scholarship allows a way for students to graduate med school without any debt, and really provides us the flexibility in choosing a profession, a career without financial burden, there's no pressure really to try and specialize in a field that you might not want to go into, and really allows us to interact a little bit more with the community. Just like this year right now, we're working on a stroke prevention program in Tarboro. All the Brody Scholars are on board, and we're planning on getting the rest of the med school classes along with us on that. And another thing that I really like about the scholarship is that we're flexible to tailor our summer programs towards our interest, whatever we want to do. And Stephanie, since she's an M2, she was actually had the pleasure of already doing her summer project. And you want to talk a little bit?
Yeah, my project last year got the opportunity to design a program on my own with another second-year student, Stephanie Maxwell. And we named our project Beam Girls, called Bright, Empowered, and Motivated Girls. It was for young girls in Greenville, just to teach them about healthy habits, and I really had a great time.
I would say one of my favorite things about Brody is the fact that during your first 2 years, the professors in the doctoring course in particular really prepare you for your third-year clerkships. I felt really comfortable this year just, doing things that you might overlook, like, being comfortable talking with patients, taking histories and physicals, taking vital signs, things that, in a number of other medical schools you really don't get a lot of preparation for, but we spend multiple hours, every semester during first and second year. But you really have a leg up coming to Brody because we have, such an emphasis on primary care, talking to patients, counseling, health education that I think once you transition into residency really gives you a leg up on other medical students.
We may all have our differences, but Brody brings us all together.
I'm Don Fletcher. I'm a professor in the Department of Anatomy and Cell Biology, and I'm the course director of the Gross Anatomy and Embryology course. As a first-year student, you'll be taking gross anatomy during the fall semester of your first year. And this course is very much lab-centered. There are about, depending on who you talk to, I say 93 hours, but other faculty may say more. But clearly 2/3 of the course is laboratory-based. And this is done by design. The anatomy faculty, as well as our dean, Dr. Paul Cunningham, truly believe that the human body is the best teaching tool for learning anatomy. Generally, you'll be assigned to a dissecting table with 3 other students. Now, other schools, you might have 5 to 6 students per table. And in other schools, you might be in dissecting groups that dissect every other day. So you'll be in there for the entire time of the course. There'll be a group of very dedicated and accomplished faculty who will be helping you. Some schools you have teaching assistants, and there's nothing wrong with that, but they would be graduate students or senior medical students. But we have faculty for the entire course, and we're in there for all the labs. We don't come in particular blocks. So as a result, we're going to get to know you very well. We'll probably learn most of your names by the end of the second week. You'll find that anatomy is a very demanding course, but it's also, we think it's a lot of fun, and you get to do things that you're probably just imagining you would ever do, like holding a human brain in your hands, or finding out how certain cancers manifest themselves in the body by virtue of your dissections. As I said, you find our faculty are very dedicated. They are here to help you. We want you to succeed. And on a personal note, I feel very gratified to see former students of mine who are now very successful and competent physicians. There are several doctors that are my doctors, and my wife's doctors, and my daughter's doctors. And I think the crowning achievement for this is the woman I taught 25 years ago was the obstetrician who delivered my granddaughter. And so I'm very proud of that. So the Brody School of Medicine is a terrific and unique place to go to med school. And besides that great education you'll receive, it's really a place that we think of as family.
Hey, my name is Dr. Emily Askew. I am a faculty member of the Anatomy and Cell Biology Department. I am teaching faculty with the first year gross anatomy course. One of the things that I love about teaching anatomy is how lab intensive this course is. At Brody, you get the opportunity to spend over 100 hours in the laboratory with the cadaver, with a multitude of teachers who team teach you. You get lots of hands-on one-on-one attention, and faculty are always willing to meet with you before, during, and even after class. The thing about Brody, as I've tried to stress, is the individualized attention that you get. I love Brody because you have the impact to make a great difference in Eastern North Carolina. And being from Eastern North Carolina myself, I'm honored to be part of Brody School of Medicine.
Hi, I'm Dr. Phil Picala. I'm chair of biochemistry and molecular biology. I've been here for a long time, and I've taught a lot of classes of medical students, and it's something that I thoroughly enjoy. I'm a scientist, first and foremost. I work with obesity, diabetes-related research, and I have a commitment to trying to understand those diseases at the molecular level. My fundamental work focuses on why pre-adipocytes or pre-fat cells become fat cells. And I have a passion for trying to understand that because it's a significant disease in this part of North Carolina, particularly east of I-95. So my laboratory has a commitment to try to improve health in this region. And I carry that on to my lectures and to the first-year medical students in biochemistry. I teach the lipid section of biochemistry, and I just have a great time doing it. I take my passion for the science and the health issues and bring it to these students in the first year of medical school. And it's just a lot of fun for me. When I can see the students in the class connect with this idea of metabolism gone bad, creating a disease state, it's just a real rewarding experience for me. I love talking about it with the students, in class, out of class. I have students come up and sit here in my office and talk metabolism with me, and a few very fortunate ones end up working in my lab that summer after the first year of medical school, and that's just a lot of fun also. So I look at it as a commitment to education, a commitment to health, and a commitment just to these students to try to help them understand that basic science is fundamental to understanding the disease states in the patients that they'll deal with. And I'll be willing to talk to any of you about the science, the metabolism, or the education. Stop by and see me.
So some of the things that I like about teaching here at Brody are first and foremost would be the students. So really, I used to hear my professor say that good students make good professors, and that's definitely true here. The camaraderie among the classes here at the Brody School of Medicine seems to be really, really tight, and that makes teaching, getting up in front of a group of students and teaching them really, really easy. So I'd say the first thing that I like about here, first and foremost, are the students. We seem to get really good, passionate students here in the medical school classes. My approach to teaching is to involve the students as much as possible. So the average attention span for a person is about 20 minutes, but yet a medical class, is usually about 50 minutes long. So if you know what the average attention span is, and you know how long the typical class is, if you think that you can lecture for 50 whole minutes and be effective, you're kidding yourself. The numbers just aren't right. So one of the things that we try and do and teach is break up the classes, or break up the classroom time roughly around that 15 to 20 minute increment. So we'll lecture for a little while, and then we use problem-based learning, where we give a clinical scenario and have the class discuss the physiology behind the scenario to truly understand, to better understand what's going on with the physiology. The other thing that we do in physiology is we really try and incorporate technology into the classroom. So we make use of a lot of the clicker technology, which is really nice. When we give a class a problem, they discuss it kind of in breakout groups, and then we come back together and we poll for what we think the right answer to any particular question may be. And that's really effective as a teaching tool for several reasons. First and foremost, the students have to discuss it, and then they have to choose an option, so they're personally invested in the exercise. They're personally curious about how the answer will come out. The second thing is, really from our standpoint as teachers, if we think we're getting a concept across to students, we can almost immediately get feedback on whether or not the students are really getting a concept or not. So if we ask a question and 75-80% of the class gets the question correct, then we feel pretty good that, okay, we're probably hitting in the general area where the students are really getting it. If we get 20 to 30%, that's a cue to us as teachers that this is something that we need to spend a little bit more time on to make sure that we cover the material. The other opportunity for students who are interested in medical school and coming to Brody is because of the small size of the classes, the medical classes, and of the faculty in general. Our physiology department has about 14 instructors. Just to give you an example, that small student-to-teacher ratio is really good for interaction with teaching, but it's also really good to provide research opportunities for students. So for the last 4 years, I've had a medical student come through my lab and do research with our group every summer in between M1 and M2. And that's been really successful. We've had really good students who have come in, who have been invested in our projects and who have contributed their work and their intellect. The flip side is that the students that we've worked with, every one of them so far at least, has gotten a peer-reviewed publication as a result of their work. And so it's really is a win-win scenario. The students come, they learn more about the research and the research experience, then they also get things like publications, abstracts, and lab experience to put on their resumes or CVs, which really will hopefully put them in a different class by the time they go for their residency and make for more competitive students. So the research opportunities here during the summer are very good, and a lot of the faculty, including myself, will often bring in some of our research into the teaching just to sort of make what we are discussing a little bit more translational across levels, both from the basic all the way to the applied on the spectrum of science. And keep playing the game and try and build research here at Brody.
Was this something you were always interested in as far as heart work?
Yeah. When I was a kid, my grandmother had a pacemaker, and I was about 5 years old. And at that time, the batteries for the pacemaker were huge, and so they would put it in, and the batteries would stick out of the chest. Mm-hmm. And I remember when I was a kid, she just put it in. She had AFib basically because of her thyroid levels and giving her AFib, and so. I was a kid, but I still remember to this day, we went to their house and she had this big battery. And just the idea that you could put a battery in someone's body and influence the way that their heart beat. I mean, I thought about this for days. Yeah. When I first heard about it. I guess in some ways I'm still thinking about it. Right. But for me, that's kind of where it all started.
Yo, Pan, you ready? Yeah. Man, let's lock and load. Yeah. Just blaze. Yeah. No, turn me up. Hey. I think we got one. Yeah. Here we go.
Tell me, what do you see when you're looking at me? Whoa, whoa, whoa. On a mission to be what I'm destined to be. Whoa, whoa, hey, whoa. I've been through the pain. how I rap for the block. Look how I rap for the hood. I get nothing but love now when I come through the hood. Getting this fortune and fame, money make all of us change. The new Benz is all white, call it John McCain. How the hell did you stop me? Why in the world would you try? I go hard forever, that's just how I'm designed. That's just how I was built. See the look in my eyes, you take all of this from me, and I'm still gonna survive. You get truth from me, but these rappers gon' lie. I'm a part of these streets to the day that I die. I wave high to the haters, man, that I finally done made it. Take a look, and you can tell that I'm destined for greatness. Tell me what do you see when you're looking at me? Whoa, whoa, whoa. On a mission to be what I'm destined to be. Whoa, whoa, hey, whoa. I done been through the pain and the sorrow, the struggle is nothing but love. I'm a soldier, a rider, and a survivor, and all the above. All the above, 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 all the above. In a way, need a change from this burnout scene. Another time, another town, another everything. But it's always back to you. Stumble out in the night under pouring rain. Made the block, sad and thought there's more I need. It's always back